Welcome back. Now we will talk about limiting and preventing the spread of COVID-19. The main step in preventing the spread has been social distancing. This is the easiest step for everyone to do when they're out in the public. This is staying 6 feet away from others and avoiding public locations if possible. Wearing a mask when unable to socially distance. Wearing a mask while also social distancing is probably the safest way to prevent the spread. But we'll talk more about mask wearing and different community levels soon. Washing your hands often and thoroughly. If you get the virus on your hands and you need to we touch our faces so many times within a day that washing your hands, you might not think you're touching your face, but I think the average person touches their face more than 5 times a minute. So it is important to always wash your hands, be aware of what you're touching, things that sort. Also, staying home if you are sick. This is really important. I don't think we do this enough in society. We're too driven to, we have to work, so we're going to go even if we feel sick. But really, I think this pandemic has shed light on people coming to work while sick, because this is how it's really been spreading a lot, especially in workplaces. Getting tested if you have symptoms. This really helps you know if you actually have the virus or maybe if it is just allergies. There are some limitations to testing, but for the most part, getting tested when you have symptoms will give you kind of the peace of mind whether you have it or not. Getting vaccinated. This is currently our best option for controlling the spread of the virus. It gets people with built up antibodies in their system so that there's a much less chance of them either contracting the virus or having symptoms of it and spreading it onto other people. So when to wash your hands. As I said, we touch our faces more often than we think. Some of the more obvious ones are after blowing your nose, coughing or sneezing. You should be sure to wash your hands. The most appropriate way to cough or sneeze is actually into the elbow crease here in your arm. So it's not directly in your hands. Either way, you should still wash your hands afterwards. When being in a public place, the same hands of different people touch doorknobs, water fountains, all sorts of things. So anytime you're in a public place, you should wash your hands often. Before and after caring for someone who is sick, it's also very important. Before preparing food, the idea is that when you're preparing food, you can get on the food and then you are then taking that food to your mouth, and there's a higher chance of spreading that to yourself, actually. Also before eating, this just continues to help prevent the spread. So wearing masks, this is also very important, and I know that there's been a lot of public debate on whether masks work or not. The science out there is that they do. There's maybe several different reasons of why they do than just the obvious. Choosing the appropriate mask is very important. You want to make sure the mask has 2 or more layers, and that it's a washable and breathable fabric. Fabrics such as vinyl and stuff, very hard to breathe through. Would not suggest, you should not do that. You want to be able to wash them because, as we've noticed, we have to use these often. And so you want to be able to wash it ideally every day. You have 7 different masks and wear a different one each day of the week. That would be nice. Make sure that the mask completely covers your nose and mouth and that it fits snugly against the sides of your face so you don't have gaps. You often see people wear their mask pulled down over their nose, or they have it puffed out so much that the air is not going through the mask, it's coming out of the mask, And the idea with the 2 or more layers is that, yes, there's holes in there, but they are layered offset from each other. So the air doesn't just flow directly through it, it has to come in and out. And then there's little fabrics on the mask that has a higher chance of grabbing that virus and kind of keeping it contained. It also changes the way that the air flows through, and so the air tends to drop a lot sooner. And so when you're wearing a mask, that's the reason, that's I think the main reason why they changed the social distancing from 12 feet to 6 feet. It's because when you're not wearing a mask, when you're breathing out, coughing, sneezing, singing, it goes up into the air and it floats around. When you're wearing a mask, it tends to just drop that, the airflow to the ground much sooner. So that's why you want to make sure that you're breathing in and out of the mask and not around the mask. The nose wire is really helpful. You pinch it on your nose and it helps it from leaking out the top of your mask. Those with glasses, I'm sure, are very familiar with this and essentially have to have a mask with the nose wire. So you do not want to have masks that are hard to breathe, such as the vinyl. The exhalation valves or vents, that's what I was talking about with, you want the air to flow through the mask so that it has the chance of catching the viral particles. If it has the air vent, then the air is just going directly out. It's protecting the person wearing the mask, but it's not protecting others as well. We'll go on to testing. So testing, as I said, there are a few limitations to testing. The 2 types of testing for COVID-19 are the rapid. These are antigen tests. They're the ones that take only about 15 minutes for you to get a result back. And then laboratory tests. These are the PCR tests. These are highly accurate. However, they can take up to 2 days to get the results back. So the rapid tests are not quite as accurate, but if they're positive, you're positive. The laboratory tests are very accurate. So if they're positive, you're positive, and if they're negative, you're most likely negative as well. It's just the slight issue with the laboratory test taking a bit longer. Someone might have symptoms, they need to go back to work, then they have to wait 2 days just to get a result back that might say negative, and then they've missed 2 days of work regardless. The antibody tests are a blood test, and that essentially detects if you have antibodies in your system. It can test for past infection, and I believe it also tests if you have antibodies altogether, so that can be from the vaccine as well. So if you are in the community with a client that is wondering what they should do, if they should quarantine or if they should isolate, use this QR code. It will take you to the CDC's quarantine and isolation calculator. It's a really convenient tool that will answer some of the questions step by step on if the person was exposed, if they're vaccinated, if they're wearing a mask, where they were, what type of symptoms maybe that the person they were in contact with, and then it will tell them what they should do. Quarantine if they were exposed for a certain amount of time, or isolate if they've had a positive test, and it will stay up to date with the current recommendations, because as we know, those do change often. Thank you very much.